Welcome everybody to Cut and Closure in 55, all on excellence and efficiency. So thanks for signing up for the course. And just like it says, we're going to talk about how to be efficient while delivering excellence. I know in my career as doing full arch dentistry, starting about 5 years ago, that was some of the biggest hurdles I had to overcome was my confidence level, the ability to complete something in a timely fashion, to not have to, take 4 or 5 hours to complete it for the patient, dragging it on where it was a bad experience for both of us and wearing me out. So not giving the fruit of the whole process. So throughout time, kind of investigating, constantly trying to find a better solution. I've run across some great technology out there from stackable guide systems from Rowe Dental Lab, Chrome Guided Smile, and a great implant to use, and then obviously some techniques that I'm going to share with you today. I'm going to go kind of quick. So for those that are familiar with Chrome Guided Smile, you're going to be like, fine, no big deal. But for those who haven't maybe done a lot of Chrome Guided Smile, you're going to be like, hey man, could you slow down? And so there's some great courses out there that teach this. Rowe Dental Lab website has some great material for teaching stackable guide system. And so you can definitely go there for more resources, but I got maybe a resource at the end I'll share with you as well. So we'll go ahead and get started here. So just for a little bit of proof in the pudding here, I'm from Springfield, Missouri. We're the show me state. So if we're going to say something can do something, or we achieved something, we got to have proof. So here's the show me. It's 8:36 a.m. We start the procedure. You can see what our condition is, right? What our teeth look like in the mouth. And then I took out my phone after suturing up, putting on the healing caps. After everything was completed, we're at 9:30. And so obviously just a little under 55 minutes there to complete an upper full arch treatment. What was our existing condition? This is kind of what things looked like at the beginning with the 3D x-ray. We had lots of periodontal disease on that upper arch, especially posteriorly, and the anterior was kind of a wreck for her. So that's why we decided to do a full arch implant system with this stackable guide system that I'll share with you. All right, so I want to kind of go through what actually happened in the 54 minutes because, that might not seem like it's very fast, for maybe a full procedure, but we did a lot. We did 11 teeth that were extracted, right? We had an alveoloplasty. We had 6 implants placed. We attached or screwed in 6 MUAs or multi-unit abutments. We had a final impression that was taken, or basically a registration of the incisal edge position, all the bites, and the MUA locations. We did that as well. It was all master planned. And then we were sutured up. So I also used an older technique for suturing, and so I'm going to share a newer one that actually wasn't used during this procedure. Now, efficiency is amazing, but this is not what we're going for. Right? You don't want to be flying through and obviously not having a whole lot of a great road to ride on, not much guidance. So the goal isn't just to be fast. Fast does a number of things for us as dentists, right? It gives us the opportunity to provide better or more care for our patients. But we want to be something like this: precision tuned, fine lines, excellent precision, exacting in what we do. And so this is really the goal, is to be fast, but still do it excellently. So why does efficiency matter? I just kind of was thinking through this from a general dentist perspective, and there might be a lot of people watching now that aren't general dentists, but some of the hurdles we have to overcome is, hey, this may not be the only treatment, or probably isn't, especially if we're starting out doing this. It's probably something we're fitting in with other treatments. There's a lot of strategies about how to do that. You could do them initially on a Friday, which is what I would recommend, a day that you don't have any other treatment, as you get your comfort level up. But then you could definitely add these treatments in, a full arch implant treatment, into your traditional schedule as you get more efficient. It's scalable, right? There's a lot of aspects of this treatment that you can pull in your team to help you. When I was starting out doing full arch, I was finding out myself spending lots of time planning the cases, lots of time, during the treatment aspect of it. And so it just wasn't something I felt like my practice could scale, even though it was rewarding, exciting. The patient got an amazing result. And I feel like we're able to scale now that we're efficient. So another amazing thing for those that are general dentists is you've got hundreds of these patients in your practice right now. Matter of fact, you're probably going, yeah, I got patients right now I could help if I was faster at this, if I could provide a more streamlined care in this protocol. And then by the end here, by the way, I'm going to share this this treatment. It's called, I just call it 100K day. Just has a fun little rhyme to it. But it's when we're able to do 4 arches completed start to finish in one day with screwed in set of prosthetics and be done by 4 o'clock. So 8 to 4. And so I'm going to give you the protocol I use for that and how we've streamlined our practice to be able to achieve that routinely now in our practice. All right, so let's get on to the excellence with Chrome Guided Smile. So Chrome Guided Smile is the patented solution that is designed, is a stackable guide solution, right? So it's fully planned, it's predictable, so we know what we're gonna get. It's accurate, so we can be precise with it if we're careful and know what we're doing. And it's optimized for the patient. I love that aspect of it. We're not just giving our patient you know, what a program or all on 6, all on 4 process. We're optimizing it based on them. Sometimes we're placing 7, 8 implants, and it's adaptable. So based off of whatever conditions they might have. So if they've got a high smile line or minimal bone, how do we address these concerns? This concept of Chrome Guided Smile adapts very well to the patient's needs. So, so I want you to meet our patient. Like I said, I'm going to fly. I'm not going to spend a ton of time on each slide. I've got some videos here that I'll illustrate. I'm going to spend a little more time on, I think, the key components of efficiency. And so it may not be as much about the actual Chrome Guided Smile process and how it all works, okay? So this is our lovely patient, Rosemary. We had quite a bit of damage, broken bridge, and you can see in this 3D x-ray, not a ton of bone, but definitely enough bone to work with. We took a 3D smile, or 3D CERC scan there, sorry, it was escaping me there. And we took a nice bite. What do we get from all this? We got a nice smile simulation, so you can see our before and after, kind of where we want to go with their final smile. And what do we do from this? We get a master plan based off of all of this data, right? So 3D impression, 3D bone, CERC plan, and we're ready to roll. So we do this all at our Cosmetic and Implant Center here in Springfield, Missouri. It's just an area that we've designed specifically for providing implant care, cosmetic treatment that's going to take a little bit longer. So we want to give people a, you know, just kind of an experience, right, where it's makes them feel super at home, invited. You know, they've got privacy. They've got the ability to watch Netflix in between arches if they're getting dual arches or waiting for their veneers. They've got a private balcony to enjoy a creek and overview the water out there. It's kind of tranquil. They can bring their loved ones with them, so it helps with anxiety. It's got these patios that overlook there. You can see the 3 Cosmetic and Implant Center suites we have here in Springfield, Missouri, at Innovative Dental. So this facility has been, you know, we've had it for 2 years now, and patients love it. It's a joy to come work in. It's one of a kind. Love the way it's helping change lives with this treatment. All right, so you know, many of you are familiar with this one right off the gate, but definitely using some sort of lip retraction, must do. You know, if you're fighting the lip the whole time, you're going to waste tons of movement trying to get the lip out of the way. So even with Chrome Guided Smile or a stackable guided system that has some retraction in it, you're going to want to use something to help you retract. And you'll see what I'm talking about here. Is I'm able to focus on the flap. You'll also know something here. I didn't get a ton of formal training on flap resection. So this could be something that's super tedious with one instrument. So make sure to use a dual instrument technique. You'll notice here I'm holding as I'm rotating. I'm rotating and trying not to, I'm using leverage, not just pushing and shoving the tissue. That's how you really wear out your hand and damage your flap as you reflect it. So this helps preserve the flap, and it helps you quickly. I mean, when I first started this, I mean, we're talking like, I don't know, 20, 30-minute flaps, and now we're like 3 to 5 minutes, okay? So it makes a big difference to use the dual-handed technique. Pinning, obviously going to give us accuracy. It's going to reflect the flap. So just the nature of a stackable guided system like Chrome Guided Smile here, it's going to retract the flap and hold it out of place with the pinning. See, I'm tapping the pins in place to make it accurate. That also helps you with the process. Like, you're wanting efficiency, right? You don't want things to move. You don't want to have to be worrying about movement. So this pinning and tapping is super critical to making sure that we've got a rigid fixation base to work off of. So that bar is called a fixation base. And then you'll notice after we remove the fixation, the guide, sorry, pin guide, words escaped me there. So after we remove the pin guide, you'll notice we have amazing visualization. So efficiency, visualization's key, right? So now we've got the obture gate, we've got this fixation base, and we've got our pin guide out of the way, and we can see everything really clearly. Now, I don't know about you guys, but I prefer to, when I extract teeth, I want every extraction to be perio. You know, if you're extracting teeth and they're not perio, right, you can risk damaging bone, lots of broken instruments, broken roots. So you've got a lot harder battle, and extractions are going to take much longer. So I make every extraction a perio extraction. I also make sure that I go in between every tooth. Obviously, bridge, you're going to have to section bridges, but in between every tooth, and I make a little bit of space with like a 330 or a 557. And that way, as I elevate, I get more movement and these teeth will fly out. Okay, so extractions, you can use the fixation base as your guide now, right? The depth of that fixation base is your reduction plane. And so using that 557 to go down and in between, I wrap around the tooth, come to the front. We're removing as much bone as possible to really accelerate extractions and save your hands, right? You don't want to get into the surgery and have your hands just be super tired. Obviously, after all this, we're going to go in and curette. We're going to make sure we clean everything out, make sure we're infection free before we start placing implants. All right, so after we've got teeth out, we've curetted, we need to get this dang palatal tissue out of the way. So if we're working on the upper arch, this palatal tissue is going to come into play as being a nuisance throughout the whole process. So this is not a new concept, but that's why I didn't put it in my top 6. But it is a necessary solution to retract it with sutures. I do use a different technique, so I'm going to show you guys how we do this here. We'll do a kind of a where the premolar, distal premolar would be, or first molar would be, to first molar. And we'll do a semi-tent, you know, we don't need to be super tight on this first one, but we want it to be tight enough that we get minimal, you know, we don't want that tissue getting in the way of our burr on each ridge. So as boring as it is to watch me suture this, it's going to be kind of important for you to see how I handle the second suture. So the second suture is where we're going to get that anterior portion of our palate and kind of make almost a clover leaf. So hopefully I learn how to tie faster there. There we go. Okay. And so the next suture, let's do it. Come on, Dr. Olson, you're going slow, man. See, this is how you don't get it done fast. So we got that retracted, and then come on, there we go. So we'll go from the anterior and we'll loop it up underneath that original suture. All right. So when we do that, there you go. See, I'm ducking it underneath, kind of dropping it in. And then now I'm going to suture everything on top of that. And so we've really used both sutures now intertwined to pull this whole clover leaf aspect out of the way for us. So now we've got a great amount of visibility. That's going to come into play with your osteotomy guide as you're placing implants. It's going to come into play when you're taking your impression, reduction, all of that. So you don't want to be fighting the palate, and that's how we handle that. Okay. Bone reduction. You know, before I was doing a stackable guide system, I was measuring and reducing and measuring and reducing and measuring and reducing. And so this aspect of kind of reducing the bite plane, I wasn't probably super comfortable with the surgery, but I wasn't super confident where I was going to end. And so this is a definite point where you're ending. So you know where to hit the brakes. And this type of acrylic burr, let me go use that there. It's basically a heavy duty acrylic burr. It's I think they call it the Mr. Hungry. But this is my favorite one because you can see the angle. The angle allows me to get, come up above that plane a little bit and clear the fixation base. But you'll also notice where I keep the water. You want the water to always hit the burr right before the burr engages the tooth. This maximizes the speed and the lack of friction, right? So it's going to help really grind the bone, and it'll just be a much smoother process. So if you have that water hitting on the backside, the water won't stay on as it goes into the bone, stay on your burr. So I know it sounds kind of silly, but even where you angle the water and how it's hitting your bone reduction burr will make a difference. So, all right, so nothing holds up anything like not having enough bone reduction. And so you may not notice it at surgery depending on your technique, but you'll definitely notice it down the road when you're trying to design and create something, right? You know, for a prosthetic. So what you'll notice here is we use a carrier guide as a bone reduction guide. So it's a 3mm wafer that's going to snap on. And we're going to see here I've got some play, right? What does that mean? It means I'm not fully reduced somewhere. Now I got to figure out where. And so I'm going to hold it and visualize it and kind of see where am I getting the rocking, because rocking is only cool if you're listening to music. It's not good if you're doing full arch implant surgery on a carrier guide. And so then after that, we're going to place it back in and we're going to get this nice flush seat. Look at that, boom, right in. So now we know we're good to go. We've got enough reduction. We're not done though with reduction, right? Now we have just this flat plane. You don't want to place implants and come back on that. What I'm showing there, I guess I'll go ahead and show you that is doing kind of a mid-surgery smile check. It's a little bit of a, I don't know, a little relief, a little kind of, hey, sweet, we're on the right track. Look at this. This is what our prosthetic's going to look like, our interim prosthetic. So pretty exciting. Yeah, I'm doing it again for you. I won't bore you with that. All right. So then we want to make sure that we don't just want to place implants immediately, because if we do that, and we have to go back and reduce or adjust the ridge, we got to do that around our MUAs or implants. So I don't know about you, but I like to have my implants in. I like to not have to go back and touch them again, or touch the bone and try to grind around it. If I can avoid that at all costs, I can avoid damaging any of the components I just placed. So I like to do this prior to. We just go around and round it, make sure it's smooth, feel it with my finger a little bit. So these are quite simple. By the way, I use a six-handed approach. There's me and an assistant, and then there's another assistant in the room that is changing out instruments, changing out hand pieces, moving the components out around, so we keep this all nice and tight and organized. All right, time to place some implants. Osteotomy guide's going to go in. What you'll notice right off the bat here is how easy it is to visualize everything. There's no guesswork here. We know where everything is going. We have depth planned. We have angulation planned. We have rotation of the implant for all of our angled attachments, right? Angled attachments. So a 17 or 30 degree MUA is going to matter how I end that rotation on my internal hex implant. So there's what you're seeing here is called our osteotomy guide. It's made out of metal. This is a patented process. So it's great for irrigation, but obviously for speed, visibility is a big one. So you can have confidence as you start drilling that you know where you're going. So this is the flat drill. It's a fully guided flat drill. It's set to make a flat platform. So nothing more frustrating than guided process being taken off course. So guides are great, but you have to know there's nuances to them. And so this flat profiler gives us a nice flat surface for our initial pilot, our 6mm pilot, to hit something that's going to help it go straight and not be deflected. So we do this. It also gives us a kind of a little bit of space. It's 5mm to give some space for our MUA, or yeah, our MUA attachment. All right, I don't know about you guys, but when I sit down to eat, I don't know, my parents when I was growing up, they told me to eat my vegetables first. You know, fill up on the things maybe you're not as excited about. They just taste better at first. And so I kind of feel that way about full arch dentistry. I feel like your focus is best at the beginning. And so things like drilling over nerves, drilling around sinuses, sinus bumps, any implant that I feel is like going to be harder for me to engage. Maybe I'm an immediate extraction, trying to hit the palatal aspect of an extraction socket, trying to guide that implant in. That might be a vegetable that I want to eat first. And so I'm going to focus on my more challenging implants and just really get them done. Another nice thing about it, right? Let's give you a quick example. I know that I'm showing an example of the upper arch, but it's also a safety and excellence aspect. So on the lower arch, say number 19 is supposed to be an 8mm implant, but number 21 is supposed to be a 16mm implant. So you might be doing an 8mm pilot on 19 and a 16mm pilot on 21. If you're not careful and you're trying to go around drilling all your pilots and not placing your implants yet, then you would find yourself with a 16mm, or maybe it's just a 10 or a 13mm pilot drill that you could easily, as a guided surgery, drill right through and get into the nerve. Whereas if you place the implant above a nerve first, then you've got a nice built-in protection over a brain fart. I don't know if you guys ever have one of those, right? So we don't want to have them, but we're all human, and so I like to think of things that help, get maybe the more challenging stuff out of the way. So that's what I'm going to do here. I'm going to do my implant that's right on my sinus first. The one I know I'm going to have a harder time getting torque, so I'm going to focus a little bit more on, okay, how large am I making my osteotomy? Obviously, all of the variables here on size of your osteotomy is going to be based off of your implant and then your comfort level with that implant. So as you use the same implant over and over again, you're going to get very comfortable with how it performs based off of the drilling. So here I'm using the Diatron Ultimate implant, and we're going to go ahead and seat it here. It's a very aggressive thread. It's going to engage that bone really well. You'll notice, I don't know, the drill I just used prior to this was 2.5 millimeters. It's a huge advantage when you're talking about full arch to use an aggressive threaded implant like this, because it allows me to not have to sit there and use drill after drill after drill to open the osteotomy. I used to use an implant that required larger osteotomies, and it was more tedious to get the job done, and then it was more tedious to get the high torque. So you'll notice here I'm going to get a pretty decent high torque. I think I got 40 or 50 on this on a very short implant. So nice. So after you eat your vegetables, we're going to go ahead and just go through the implant process with the high thread, aggressive threads, a little longer implant, and we can start flying through the rest of these. So let me show you here. Yeah, systematic osteotomy. So we start thinking about how can we make, basically you should have studied in advance, right? So walk into the room prior to surgery or in between while the anesthetic is setting in, look at all the implants you're placing, and have a good idea of your lengths. And when you plan your cases, I like to plan them where I have a decent amount of symmetry that helps me as I'm drilling and which drills I'm going to have. But I try to use the drill that I have on the handpiece on all of the sites that it's going to benefit. And so that means we're not going to keep taking off and on and doing one implant at a time, because I've already taken care of the ones that are sitting right over vital spots like sinuses or nerves. Does that make sense? So we're really trying to accelerate the rest of the implants that are maybe safer, easier, more predictable, because we've already taken care of the ones that are maybe a little more challenging, require a little more attention. Here you'll notice aggressive threads, getting 70 Newton centimeters. I only did this implant. This is a 4.2 millimeter implant, only a 2.5 millimeter osteotomy. You'll notice here too with I like the hand feedback. I know that there's a lot of different approaches to this, but the torque wrench gives me a lot of feedback as I'm using it on how the bone's going to behave. I feel like I get a better judge on that, and you can see I'm almost tapping out at 70 there, right at the depth. And I'm right at depth there, and I'm like 65, 70, right? So I like to see that. Same thing, flying through. You can really see the visibility of the implant getting flush. It's another thing too, right? If let's say you've got 2 or 3 threads that are up, you can always easily make the judgment if you want to go down a little bit further. Okay, now we got all our implants in. We gotta keep scooting along to our impression, right? So, I wish I had a better solution. I think there are some out there like bone profilers, and I have a few. To me, they still take a while, and they can not work with the angles of all of your MUAs. So that's another thing, is know how the MUA fits your implant. You can do that with an implant analog. You can do that with an implant that you just have sterilized, and you can really put those in the 17 and the 30 degree on the implant and visualize what that trajectory or what that emergence looks like. It's going to be super helpful for you, because then when you go in with I'm just using a round burr and being very careful. As general dentists, right, we're used to prepping teeth all the time, right? So doing something this close to an implant is not too much different than just prepping an MO on 13, trying to avoid number 12, right? So that's kind of the idea, right? We're just going to polish around these. Obviously, a few of these are angled, and angleds are going to have 90 degrees, sometimes coming right off, depending on your MUA trajectories, or your MUA emergence. I don't know. I don't want to be figuring out which angles these go, right? So not only the osteotomy guide, and I kind of skipped through that because that's probably more into Chrome Guided Scalp, the Chrome Guided Smile discussion and training, but that osteotomy guide helps me time that implant. but now I need to know which angle to place the MUA. And so, darn my hair getting out of the way there, but you can see there's a little black notch there. That is, I'll go back because I think I want to, yeah, I want you to see that a little clearer. So that black notch is where I'm lining up the screw. And so it makes this very accurate as far as placing your MUAs. Very quick too, so excellence and efficiency. I've heard doctors say, I never want to use angled MUAs, and I'm going, after I've found this system, I'm like, doesn't bother me. I mean, use them if I need to. The nice thing is angled implants allow me to get the best bone. And man, I guess if you always have ideal patients, not using angled implants is awesome. But you know, I don't know about you, but my patients aren't ideal. So I have to find the bone where I can find it. Straight MUAs, little technique here. I don't know, this is kind of silly, but I figured this one out. When you twist these on, at least the implant system here, you can tighten it down, push, and then rotate it off. And you don't need another instrument to hold and try to, so if you just are pushing down as you back off your delivery, your implant system's likely to release that straight MUA. Okay, so that was a little trick for straight MUAs. So here I'm checking the trajectory of the MUAs. And there you go. We can see they all are as planned, come through the nice portion of our pre-cut. By the way, this is a pre-cut prosthetic. So when you see these holes, we didn't have to go drill in these. It's another reason why this is efficient, right? So we're just checking for passivity, making sure everything's smooth and clear and not putting any sort of pressure. All right. Now we're going to use rubber dams, very small ones that are pre-made for us, to go on top of all of our impression copings that are screwed into our MUAs. And once we get these impression copings on, we're going to be ready to seat. And I know if you're wondering how in the world does that seat, can you see the arrows? I don't know if you can see my mouse, but there's can you see the male components there in the carrier guide? The carrier guide is going to have those male components, and the rapid impression piece, which is this component here, is going to have female on the underside and the intaglio there. So that's how it's going to index correctly to our carrier guide. So we know this is perfectly lined up with midline based off our plan, our cant, the depth and angle, all of your bite here is very accurate. And keep in mind, this is all based off of the tooth position, right? Remember the pin guide at the very beginning that fixed that fixation base? It was tooth-borne, right? So in this scenario, we have a very accurate fixation base, and everything built back. So the stackable guide system coming back is just as accurate as our tooth position, especially if we've been careful to maintain that rigidity. Pretty awesome. So now I'm using Stellar, which is dual cure. Don't look at the blue light. Just teasing, it doesn't hurt you through the screen, right? But it's dual cure, so it's very fast. You should buy some stock in Stellar. You're going to go through quite a bit of it. All right, so surgery's over. We've got this beautifully picked up what we call a rapid. I'm going to push it down. I do what's called a parachute check. So why is this important? Nothing worse than finding out later that you can't seat a prosthetic or something doesn't seat right. So here's a nice last chance verification to seat this rapid and verify that everything is flush. So now we know we're golden, right? We know we're set. We've got a very accurate record of everything we've worked for. So I'm talking about surgical efficiency, but when we talk about prosthetic efficiency and completion of the case and how many visits it's going to take to finish, that rapid and what I just showed you there with that has saved me countless hours of frustration and given my patients a really nice result in a matter of just maybe as little as three visits sometimes, okay? And then we put some healing caps on there. And I think I've got a decent video here that shows, yeah, we're going to take the pins out, right? Pin removal. All right, now let's get on to suturing. We do need to trim the tissue. I kind of skipped through that, but trimming the tissue, you want to trim it to about the midway of your healing caps. It's been my best experience there. It gives you enough of that nice palatal connective tissue without overdoing it and hindering the seat. I'm not going to go into great detail here on the suturing technique, but I will definitely show you in just a second on that. It's definitely one of the, I call it the kind of like 6 keys to making sure that these surgeries will fly. Obviously, all of these slides and getting efficient with the whole technique will help you. But I think there's kind of a few key areas that I thought through that have maybe hindered me the most and slowed me down. Suturing definitely, I think is, I talk to a lot of doctors in our courses, and that's something they say is like, yeah, suturing, how do you suture? And so this is going to be a good technique to share. All right, healing cap removal. I'm going to fly through this because we're going to do that. You know, you remove it, you're ready to seat the prosthetic. Let's go ahead and just show you. This is more just for satisfaction. We as all dentists want to see, hey, wait a second, what did it look like in the end, doc? So obviously same day surgery, so you won't get to see her smile and she's all numb. But there's our seated prosthetic, and it dials right in. The one screw test, you tighten one down and it should be very passive and then nice and tight immediately. That tells you great fit, right? So that's a good feedback. And then every other screw should just be boom, 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 boom. If you have, you tighten down a screw and it's slowing you down and you're binding and it's slowly tightening, something's hindering your trajectory and not allowing you to be passive, okay? There we are, there's the payoff, right? We all want to see it. And that's the bite. This is excellence, right? So fast surgery, awesome, efficient, patients love it, we love it, our backs love it, our assistants love it. We can do more of it, so we can help more people, we can help our bottom line. So it's a win all the way across the board, but we didn't just do it at the cost of excellence. And so I like this last video because it shows how excellent the process is, and it turns out fantastic for your patient and for your practice. So we just use Teflon tape, cover these up. I don't want to bore you to death. Okay. So let's get on to the 6 greatest time hacks that I feel like will really transform full arch dentistry for you. So it would be absolutely ridiculous for me to not give you the one that I think is key, and that's the chrome guided smile. Because for me, as a dentist, I know that some of my buddies over at Roe Dental Lab could tell you, I connected with them 2 years ago saying, man, I've studied all your system. This is answering all of the questions I had about, you know, quality of the work, helping me fly through surgery so I can make this, you know, something I could duplicate and scale with less time, but still deliver an amazing result to my patient. And this is by far, in my opinion, doing a lot of surgeries now. I've tried a bunch of different systems. I'm not going to name them because I'm not here to bash them, but I have tried a lot of different approaches. I've tried a lot of different implants, a lot of different full arch approaches. And I can say with confidence, this is by far the most advanced. Not just that, but it's got the most information to train and help you be supported as you become competent with this. So has everything you need. All right, so I told you earlier that flap technique drives me crazy. And if you're a surgeon here, right, or if you're somebody who got some extra really good training on flaps, you're like, whatever, man, I got that figured out. I didn't. So I'm trying to help anybody else that might be like me that says, man, I push, my hand gets tired. And so I'm telling you the two, and I'm going to show you in just a minute, but 2 hands makes a big difference. All teeth are perio teeth, right? Stop taking out teeth that aren't perio. Make them perio. All right, aggressive self-tapping implants, key. There's a lot of good implants out there that will work. I've used, I used one that was a tissue level. It had threads. It was very minimal threads though, and kind of a round bottom. I'm not naming the name, so I'm describing the implant. It was very much a parallel implant. It was designed for full arch. I was told to use it for full arch from the training that I got for it, but it was difficult to get a nice rigid fixation day of surgery. So yeah. And by the way, I promise you guys, I'll get to your questions. I appreciate you putting them now though. So yeah, if you have questions while I'm going through this, throw them in there. I'll make sure by the time we're done here, we'll go back. I'm probably got another 10 minutes and then I'll make sure I get that. So eat your vegetables, right? So that way you can fly through the rest of it. And then that suture technique is called the Holtzclaw suture technique. Thanks to our buddy, Dr. Holtzclaw. He's a great surgeon, fantastic full arch. He's got some great books, so I'll tout him and give him a shout out here, but you'll find great information from him. All right, so I have to show this because I feel like as we're going through, I'm saying chrome guided smile is the way to go. There's other things, right? But I want to use some analogies. So to me, this is what? A railroad. This is one spot to a particular destination. It's streamlined, it's fast, right? Some of those trains go like what, 300 miles an hour, I think, but they're safe and they're excellent at getting you where you want to go. So it's on a guided rail, right? So trains, phenomenal. Then there's another option, right? We have GPS. Get in a car. There's roads out there. You just got to follow what the GPS tells you to do. Take a left here, take a right here. Go, watch the speed limit, do all that, right? So there's a speed limit because you're navigating. And then there's, in the woods with a compass. Anybody that's skilled will find their way there. Maybe a little slower. I'm exaggerating. Nobody's going to probably be walking that slow. Dang, it's slow-mo. But with the compass, people that are backwoods, they're skilled, man. They've got it figured out, and they will find their way to the destination. So what does this look like to me? Chrome Guided Smile's the train. It is what I want to be on. I want to get on that train. I want to ride from point A to point to Z, and I want to be safely within the guardrails of where I've planned to go. And I want to be focused on things that I really want to nail, like implant, fixation. I want to get that rigidity, that fine-tuned bone contour, and I can do that with a guided system like Chrome Guided Smile. Not picking on anybody, but I do need to point this out. I get this asked all the time, and if I get another sales rep, probably get one tomorrow, telling me I need to come tour this thing, and it's cool. It's cool, don't get me wrong. Robot guided surgery, it's awesome. It makes me geek out, of course, and I've not even done it. I've just watched it. I'm like, that's cool. But for full arch implant surgery, I'm kind of going, I need a prosthetic, I need bone reduction. I'm gonna have to sit there and follow it as well. And I've already got all that figured out with Chrome Guided Smile. I've already got a stackable guided system that's taking me to the destination much faster. And I still need all those other components to get there. So, yeah. And then freehanded, right? I think, like I said, I respect those. I was giving the analogy of those that use GPS. I respect those that can do it, the skill that it takes to do it well. Obviously, it's my argument would be that, especially with skilled and planning, guided surgery, we can get there a little faster and we can get there with a little bit better precision. And I've heard some very skilled surgeons that have done freehand for a long time make that confident statement that guided surgery has really changed the way they approach full arch. All right, so I want to show you the double instrument flap. So you'll notice I'm using one instrument here in my right hand and I'm rotating it as I'm reflecting with the other. And I'm using them against each other, so the rotation is pushing, just teasing that tissue. So it allows me to move much quicker. I'm showing on the bottom how this works really well. See, I'm using that leverage. On the bottom, you can place it on a premolar and rotate to get that tissue off of a molar. So these little, techniques where you just don't have great access or difficult visibility to really get that tissue off of the bone and tease it, especially if you've got infection or periodontal disease, it gets even harder. Or God forbid, a denture. Dentures are even harder, right? The tissue just really loves hanging onto that bone. This two-handed technique is a big deal, or a two-instrument technique. All teeth are perio teeth. I kind of hit that pretty well, but definitely go through and around and get rid of that bone. For the 5 minutes you'll do this, these teeth are gonna fly out, and another huge benefit is you're not gonna take out bone you didn't intend to. So I think it's not just about efficiency, it's about excellence. You're gonna help keep yourself not removing what you didn't want to remove and then grafting it later. Aggressive self-tapping implants. Well, a number of reasons you need this. This is the Ditron Ultimate implant. It's aggressive. It's very aggressive. It's extremely self-tapping, meaning I don't have to make these giant osteotomies and drill more and more, which just takes more time, removes more bone, right? So here I preserve the bone. I get a nice aggressive, tight thread. An implant goes in beautifully in no time. So, and I think I showed and illustrated here, it climbs to 70 Newton centimeters pretty darn quick. All right, I showed you earlier how to eat your vegetables, right? Place the short implant above the sinus, place your shorter implants, your 8 millimeters, your 10 millimeters above your IAs. Those are all kind of strategies to tackle the things you don't really, are maybe less comfortable for you. And then I'm going to go through this in detail here. So let me jump on into this slide. So the Holtz-Claw technique is something that'll save you gobs of time, save your assistant a ton of time too. So you'll notice here, first thing we're going to do is create a mattress suture. but we're doing it down the midline, or for this example, I'm doing it to the left of the midline implant. And I'm going to do that because it's going to take the palatal and the facial, and it's going to lock them in their space so we don't see the shifting as we go and start suturing. If we didn't do that mattress, you would start to see one side start to pull to the other, okay? And so here we are, we're going to fly through it, but we're going what's called the Texas two-step. And so after I do that, okay, Texas two-step, here we go. So punch through the facial to the lingual, going to come back from the lingual to the buccal. So that's the two-step aspect of it. So lingual, buccal, and I usually try to do a couple in between the implants depending on how far apart they are, usually somewhere around 5-6 millimeter bites. And then we're going to do the same thing on the facial here to the buccal, or facial to the palatal. Hopefully I'm speeding this up a little bit for you guys. And then we're going to get it all the way back to the distal implant. And after we get to the distal implant, we can really speed along. I think I've got this all sped up pretty nice at that point. Yeah, what is the brand of, I'll answer a few questions. Brand of wrench I was using is it's a Blue Sky Bio fully guided kit for internal hex implants. All right, so there's the, doing the distalmost implant, still doing our Texas two-step. Is it making sense staying on the same side, going right back in? What it's doing is it's really taking your tissue and doing this. So you're bringing it and kind of doing that. It's not really holding it over each other very well, right? But it's so nicely approximating and cinching it up high and trying to pull it up over the ridge, which is nice to get that primary closure that's going to help during your healing process. And it'll also help with your hemorrhage. So now I'm speeding it up. I think upper arch is about a 10-minute total for me right now. I'm trying to always get faster, but I don't know if you can see. Oh shoot, I went too fast with that. But here at the end, I'm looping back. Okay, so after we get to the most distal, we looped back, and it flew too darn fast, I think. But you can see, I got all the way to the distal back here, and then all we do now is single loops. So over the ridge, single loops, all the way back to the midline. So Texas two-step on the way back, and then single loops back to your midline. All right, so I'm going to take some questions here, but I wanted to at least tout this. So those are kind of the 6 components there, right, that speed along the treatment. But I want to say that one of the things that's transformed our practice is really realizing that this is a full-on team approach. And so trying to see this treatment grow in our office has been way beyond something I could do on my own. I have to fully engage our team. And that means obviously the assistants, but it really goes all the way to front desk. It goes to people answering your phones, the treatment coordinators. How do we bring them into the excitement of this? How do we bring them into the understanding? So that way they help us market it, help us treatment plan it, help us get the word out for patients. This is what's different, I feel like, when we're talking about high trust treatment, which this is high trust treatment. We have to have a whole team doing this. We also need to have 3,800 reviews is what we have on our Google. So you need to have tons of 5-star reviews, I think, to drive confidence for patients that are going to part ways with $25,000 in arch. And so this course here that we do is we show, it's really team focused, but we do show doctors obviously the surgery. You're going to get to see a live surgery. There's a live hands-on with Chrome. You're going to have team breakouts where your team's going to have lots of information. It is honestly, this is really inexpensive course. We do it that way on purpose because honestly, we're not trying to make a big buck on this thing. It's exciting. It's fun for our team. It kind of, honestly, on a little bit of a selfish note, it makes our team more excited about what we do. And so they get a lot from these times with other offices that are excited about dentistry. It kind of refuels us, regenerates us to go have another great 6 months as we treat our patients. And so those team breakouts are big. You're going to get a ton of CE there. And then we keep the price low, once again, so you can afford to bring 4 or 5 team members. We want you to bring them with you. We know they're critical to your success in this. And I think this course would help with that. So there's me pitching the course. Click the QR code. We'll go over all the, use the code 55 minutes. It's $200 off. Okay. Here is the 100K day schedule. So I told you I'd share that with you. So it's obviously using a minimum of 3 treatment coordinators. or sorry, not treatment coordinators, 3 assistants, and it's going to provide obviously how they would flow, how your patient would flow, and how you would flow. So, we do this routinely, really weekly now. So these treatments, I know kind of the headaches and challenges with them, and so I think you'll be able to find the value from this as you grow. Maybe some of you guys are already doing this. That's awesome. Maybe you can share with me. But I think that this 100K a day schedule will help those that are trying to be able to do more than just two arches in a day. This will give you obviously how to do 3 or 4 arches. Okay, awesome. Time for questions. We're at 45 minutes, so I think we got about 10 to 15 minutes to take on any questions you guys might have. So I'm going to scroll up here and see where we're at. It says, yeah, since I've had multiple implant systems, do you prefer key or keyless system currently? Absolutely, 100% keyless. Very big advantages to having one hand free to stabilize your osteotomy guide, help with control of the implant as you're driving it maybe close to a sinus, and free to grab other instruments, retract. The last thing I want to be doing is holding a key, and I've used multiple keyed systems. Matter of fact, 2 or 3 keyed different keyed systems. Hands down, keyless, way to go. I don't think keyed systems are going to be around much longer. I think that's kind of a doctor's consensus on what they would prefer if they'd use both. How much does the lab fee for Chrome guys smell cost? I'll let Chrome answer that. I'm not certain exact fee on that, to be honest with you. Okay, and it does matter depending on a number of factors and variables. I can tell you it's based off of what I was doing before. Designing guides, spending the time doing all that myself, I found that it's incredibly beneficial for me to use and pay them for their services. It's helped us scale. Okay. Hey Doc, 2 questions. Do you ever let's see. Do I ever need to remove rapid appliance before the final? I'm not sure I understand the question, but we do put the rapid back in to take our final impression. And that goes to the lab. Oh, by the way, I forgot to mention this about the course. We have a certified lab technician here that's going to teach how to stain 3D printed prosthetics. Pretty awesome. So your team's going to get some information on how to do that, what materials to get, how to 3D print, what material to print, and how to make it look really nice if you want to do a digital process of 3D printing them rather than doing an analog conversion in your office. Okay? Yeah, what is the purpose of placing healing caps before sutures? So healing caps are going to maintain the space above our MUAs because we're going to come back with our provisional and screw the provisional in. So we want to maintain access to our sutures, to our MUAs, and we also want to give that tissue a spot to kind of get nice and tight and make a nice little shape with our connective tissue around our new prosthesis that's going to go in. Yeah, the flattening burr I was using, Alan, good question. That is on Roe Dental Labs website. So it's phenomenal burr. I think they call it Mr. Hungry, but it's in their store there. How long from anesthesia to start patient release? Yeah, so we use a technique that allows us to get great anesthesia for at least a few hours, but and we teach that at the course, and I share how it's worked for us really well. But it is, you gotta wait 15 minutes. I think as doctors, we talk about efficiency here, and this whole thing's been about how do we make this faster for us. But this is one area you can't cheat. So especially on upper, but I think lower kind of still stands. It's because if you start too soon and lay a flap, you're going to notice that you're going to lose anesthesia pretty quick. It's because you just release the incision or release the flap, and now all your anesthetics are washing away. So I set a timer of minimum 10 minutes, usually 15. I go do a couple exams. I go, chat with a couple of patients. It's kind of hard for me because I want to get going. But yes, that's a great question. Give yourself some time. I see them next day for follow-up, and then I see them 5 to 6 weeks down the road to verify that they're not clenching and grinding on our provisionals. I want to verify where, so that's kind of what we do for that. Any tips on anesthesia? Yes, I'll teach all that at the course, but you want to use a combination of anesthetic and not just one, because not everybody responds the same. And then you want to time the locations based off of the least amount of pain and help everything flow to give the patient profound anesthesia without raising the anxiety. And yeah, that's a good next question. So do I use sedation? No, I don't use any sedation. I think that kind of shocks people, but we've done hundreds and hundreds of arches, probably 300-400 arches without sedation. I will probably not do sedation ever. I don't see that as anything. Every patient that's ever said that, man, I really want to be sedated, we talk to them about the process, talking about them being able to control their airway, not having any issues with patients that have anxiety. They all are, we give them Valium, they are chilling. Most people are snoring by the time we're suturing. So that's even with high anxiety, and I think largely because our average time, now obviously I gave you an example of 55 minutes, but our average time is probably an hour and 15 minutes. So we're fast on this, so it's not like we're dragging it on and really, making the patient super anxious about it. All right. Do they do the implant? No, we do all the implant maintenance here. So we're a full service office. That was somebody asked, where do we do for maintenance? All right. Yeah, we're doing all of these surgeries without IV sedation, every one of them, David. Yep. And I think once you see us do these live, it's amazing. The patients, they make it out to what we kind of make it out. So if we make it really sound like it's pretty awful, which it doesn't have to be, then they're going to have that level of anxiety. But yeah, it's a cost hindrance. It's a time hindrance. There's no way I'm doing 4 arches in a day if I'm sedating every one of my patients. And then obviously, how do I have two people helping me manage sedation? And then, the experience for the patient, I don't believe is any better. The recovery's longer. They have to get all those meds out of their system. So I know there's people that disagree with me, but I think I've been able to prove that it's working really well for us. So to each their own. All right. Let me make sure I'm answering these. How do we get these full arch patients? What advertising companies do you use? Yeah, so there's no real one way to do this. I feel like we do quite a bit of internal marketing. That's one thing I love about being a GP that does this procedure is you probably, everybody on this Zoom has plenty of patients that likely need this treatment, that bringing the team in on this, getting your reviews, 5-star Google reviews up, we go through the protocol of how we do that, right? It's not by accident we have 3,800 5-star Google reviews. We have a strategy for that. It's very ethical, but it makes sure that our team delivers 5-star experiences and gets 5-star reviews. So that helps drive, right? Google performance is always going to be excellent for us because of our reviews. Do you prefer metal framework? Absolutely. I've used 3D printed ones. They're not even close to the same, right? Metal is the feel of metal, the rigidity, the visibility. It's night and day difference for me. I do not like plastic guides. Do I use a stellar for both rapids? Yep. Well, no, because I usually I'm not picking up both rapids at the same time. I break up the surgery into upper and lower arches. So upper arch, about an hour and 15 minutes. Let them sit for an hour, do another arch, come back. And part of that guide, if you hit that 100K a day, I will go through how we do the bounce and how I go back and forth. Okay, so you'll see that in that package, or it's PDF. All right. The patient stays in their provisional while the rapid goes to row. So there's 2 prosthetics. I only showed you, by the way, those that are watching that aren't super familiar with Chrome Guided Smile, you only saw the impression component. You didn't see the conversion of the temp. Okay, that's a different component. Oh, okay. Alan's asking, what's the not the Mr. Hungry, the initial burr that flattens the bones? It's a flattened burr that comes in the Blue Sky Bio kit. So the internal hex kit came with that. All right. With all the costs associated with full arch and the Chrome guide, how are you making a profit such as low fee? I don't think our fee's low. $25,000 an arch. And so I feel like we've done pretty well with this. There's more, if you can scale it, the fee becomes less of an issue But when I was paying other labs, by the way, so I mean, I don't want to make this all about the funds here, but when I was paying other labs, I was paying just as much for something that took me more time. So my time is and your time is valuable, and so that's where I think you'll make off ahead of doing this system. Yep. Okay. I think I answered what was the first drill. That was the flattening drill. Yep. Does it stay till you send it in for final? Yes, we keep the rapid in our, we keep the rapid in our office and we screw it back in. So that's a great question. Yep, that's exactly what we do. All right. I guess I should be clicking these when I answer them live. The rapid for the patient, how convex, hygienic are you making them? We try to make them convex for sure, so we don't want them concave. You know, they don't have to be crazy round, but we want them smooth. All right, website to register for the course is rheostat.com, rheostat.com. So if you're still listening and you're going, hey, I want to register for that course, you can go to rheostat.com. That $200 off. The doctor is going for under $1,000, so pretty awesome. You're going to get to do live surgery, see a live surgery, or sorry, you're going to get to do hands-on, see a live surgery. So hopefully you'll enjoy that. Yeah, I can go back to that, you bet. Let me go back to, let's see. I'm going to put that back up for you. Play. Let's see. I'm going to go back. There you go. 100K a day schedule. Got it? Perfect. All right. Let's see. Any others I didn't answer? So a few of those you asked, what do I get the prosthesis in the guide? Probably need to go to Chrome Guided Smile, Row Dental Labs website. They'll go through exactly what they need. Yeah, PRF, awesome technology. I haven't used it yet. I get great results without it. I'm sure it would accelerate the healing. I'm not against it by any means. Might add that. I would add that long before I would add sedation. General costs using the iVotion material for peeps who can't afford the Zerk. Yeah, so in our office we offer 3 different options. We offer a preserve, which is 3D printed material, a provisional, which is a milled iVotion material, and then the Zerk. And so we charge anywhere from 15 grand an arch to 25, and it's just $5,000 increments. So it's 15, 20, 25. And most patients go for the 25, to be honest with you. I thought when we started offering the 15, a lot of people would take that. What's amazing though is that having the $15,000 option of preserve gets a lot of people in the door, because it's an option, and we still offer it, and we still do the implants, and we're doing a 3D printed teeth, so we're not really spending a ton on a final prosthetic. But you know, people usually come in and talk themselves in and get financing for the provisional or the full Zerk at the end. You guys are awesome. I hope it was helpful. I hope we have aren't just efficient, but I hope we are excellent, right? That's part of the whole thing put together, and hopefully some of the tips I gave there would help you, some things to think about and improve your efficiency and be able to scale this a little bit more for your patients, be able to help more people, give you more excitement about the dentistry you're providing. So it's been an honor to share my excitement for this process and this procedure, what it's done for us in our practice here at Innovative Dental. I would love to see you at this course. It's a fun time. We have great barbecue, lots of good drinks, and you know, you get to kind of hang out with us here, and we get to learn from you too. So it's a good time, and your team is more than welcome. And I think we've had great results at our courses. We've had a number of these already. So lots of great courses on this procedure. This one is in my opinion, the most geared towards your team and bringing them in along beside you. So thanks so much for having me here, and thanks for your time this evening.